So, okay, wrap it up. So LDN can be very helpful, especially for patients whom help has been very difficult to come by, right? And this is a lot of these patients. Nobody believes them. Nobody believed they could take all that medication and still feel bad. There's just like nobody, like they want to just be told that what they have is real, and they just haven't found the right tool. Nobody's found the right tool to help them. Slow down. Whether you're the doctor or the patient or the pharmacy, know that it's slow and slow. Patience is a virtue. If you overshoot, don't feel bad, come back, reset. This is just, it's very dynamic, this medication. I find that a pain diary, a log is helpful, a line or two. Sometimes patients don't even realize the subtlety that, look, 2 weeks ago, I couldn't do this, I couldn't do this, I couldn't do that. And now, I went to the movies, picked up some apples from the vegetable store, I wasn't doing that, now, I feel better. Understanding is a leap of faith for many people, and education is the key to take the leap out and make it a step in the right direction. Availability can be an issue, but not really. Actually, recently they've just been, you're able to reach out to many. Many compounding pharmacies do have multi-state licenses. John ships wherever my patients are, and or to Florida or somewhere, and John can just send the medication to wherever it has to go, for the most part. Not everywhere, but for the most part. And if not, we can find a compounding pharmacy locally, and there's a compounding pharmacy network that people communicate. They're nice to each other usually, and we can get the medication to those patients that need it there. Availability can also be an issue in regard to doctors. There's some doctors that just like, no, I don't know this. There's many doctors that do LDN, on Zoom, myself included, especially, COVID, as bad as it was, helped this, that you don't need to get multi-state licenses. It's going to come to an end pretty soon if it hasn't wherever else, but you don't need to get multi-state licenses to treat people from out of state, on Zoom. But now it's harder, but when COVID was really raging, you can see people everywhere. And then, then usually once a patient is established, then other physicians don't mind continuing the medication. The dosing and schedule are fluid. Don't get stuck on 4.5 milligrams. Just be fluid with it, okay? And then don't be fluid. This also comes in liquid, and this also comes in gels. So it's not just a pill.